everyone. Welcome back to the deep dive. You know we love to get to the bottom of things here, and you're the kind of person who wants to get to the good stuff quickly but thoroughly. So today, let's dive into something that's pretty fundamental to health: vitamin D.
Yeah, we're going to be talking about dosage specifically and looking at some recent research that's pretty compelling and kind of throws a curveball at what we thought we knew.
Okay, so I came across this video by Dr. Campbell. It's on YouTube called Vitamin D Doses, and it was uploaded on Monday, May 15th. Now, the big question it poses is whether the current recommendations for how much vitamin D we should be getting are actually too low.
Right, exactly. That's what we're going to be unpacking for you today. This video brings up some comparisons looking at the amount of vitamin D our bodies can potentially make naturally versus what's recommended we should be taking in supplement form.
So the mission here is to explore this question of whether the official recommendations are outdated and whether we should be taking more than we're currently told. And the video brings up some pretty surprising things about the amount of vitamin D our bodies might be able to make on a sunny day, naturally, compared to what we're advised to take.
Yeah, and it goes into the history of how we got to these recommendations, which is fascinating. And probably most importantly, we're going to unpack the findings of a 7-year study that was done looking at people taking much higher doses of vitamin D than are usually considered safe.
So are we possibly underestimating our vitamin D needs? That's what we're here to explore.
Yeah. What's really fascinating is that this study makes the point that a normal, sunny day could lead to us making around 25,000 units of vitamin D.
Wow, 25,000, that's a huge number.
It is.
And then you look at what the UK government, for example, recommends as a daily amount, which is 400 units.
Right.
That's a massive difference. Yeah. It's almost hard to even wrap your head around. So that's the first kind of major insight here, is that potential discrepancy between what our bodies might be designed to get through natural sun exposure and then what's officially recommended.
Yeah. And it kind of begs the question, why is there such a big difference?
Right. So the video digs into a little bit of historical context to try to understand this. It talks about early research on vitamin D back in the 1920s and 30s when there was this kind of initial surge of optimism about its ability to treat things like tuberculosis, psoriasis, rheumatoid arthritis even. So people were using very high doses.
Yes.
And by very high, the video is suggesting around 10 times what we might even consider high today.
Right.
So that initial, sort of over-enthusiasm actually created a problem, didn't it?
Yeah, it did. Because they ended up using such high doses, and then there was a bit of a, I guess, backlash or sort of a concern.
So they got a little too enthusiastic, and then people started to maybe get some negative effects from it. And
Yeah, and I think the term that's used in the video is dosage paranoia. So they sort of, swung in the other direction and brought the recommended levels right down to the much lower levels that we see today.
I see. That's so interesting. So it almost kind of set us on a path of being a bit too cautious?
Yeah, potentially.
Because of that early experience where they were using way too much. So now the video then turns to this more recent research, the study that was published. It's called Daily Oral Dosing of Vitamin D3 to 5,000 to 50,000 units a day hospitalized patients. Insights from a 7-year experience.
Okay.
Now, that's a really wide range of doses that they were looking at.
Yeah, it is.
And what's interesting is this was done with patients at a psychiatric facility. And so that provided this unique opportunity to monitor vitamin D levels and supplementation consistently over a long period.
Yeah, and it also was over a 7-year period, which is, pretty long time.
Yeah, a good chunk of time for a study like this.
Yeah.
And the study was published in Steroid Biochemistry and Molecular Biology, and it was conducted in Dayton and Cincinnati, Ohio.
Right.
So right here in the U.S. Okay, so let's kind of connect this back to, what our bodies can do naturally. The study authors are, saying vitamin D is a hormone that's produced in our skin when we're exposed to UVB radiation from the sun.
Right.
And they're also supporting that earlier point that if you're getting a lot of sun exposure, they estimate that you could potentially produce up to 25,000 international units per day.
Yeah, it's pretty remarkable.
It really is. You think about, our ancestors who were probably spending a lot more time outdoors and the way we live today, indoors.
Yeah, exactly.
It really does kind of raise some questions. So the video also talks about the fact that vitamin D deficiency, which is something we hear about, quite a bit these days, can lead to a number of potential health problems.
Yeah, and the authors of the study link it to a few key things. They talk about limited immunity, heart disease, multiple sclerosis. They also talk about autoimmune diseases. And then quite significantly, they point to a strong correlation with colon cancer.
Wow.
And they also say that there are probable links to prostate and breast cancer as well.
So a pretty serious list of potential concerns. And it's interesting because it kind of connects with that historical mention of using sunlight to try to improve things like asthma and psoriasis, rheumatoid arthritis, even tuberculosis.
Mm.
So there's the sense that, intuitively maybe we understood the benefits of sunlight even before we understood the science.
Yeah, definitely.
Okay, so let's get into this experience that they had at the psychiatric facility with supplementing with vitamin D.
Okay.
So from 2011 to 2018, they were routinely screening everyone who was admitted to the hospital, to the facility, for vitamin D deficiency.
Right.
What really stood out to me was the number of people we're talking about. It was over 4,700 admissions. And the majority of them agreed to take supplements if they were found to be deficient.
Yeah.
And the typical doses they used, were between 5,000 and 10,000 units, which is already significantly higher than what's, that 400 unit baseline that we talked about.
Yeah, definitely. And in some cases with people with specific conditions like psoriasis and rheumatoid arthritis, they were actually giving doses of between 20,000 and 50,000 units a day.
Wow, that's a lot.
It is.
But this was, of course, all done under medical supervision.
Yeah, exactly.
And this is where it gets, really kind of key. There were no reported cases of vitamin D-induced hypercalcemia. So that's high calcium levels in the blood, which is one of the main concerns with taking too much vitamin D
Right.
in any of these patients, even the ones taking the really high doses.
Yeah, and they made a particular point of saying that they had no incidences of it.
Yeah. So this is like a really key finding because it's showing that these higher doses that are often seen as dangerous weren't causing this problem of high calcium levels.
Yeah, exactly. They did find, though, that there was some clinical improvement in 3 patients with psoriasis who were on the higher doses.
Interesting.
So it's just interesting to note that obviously it's a very small number,
Yeah.
but it is, noteworthy. Okay, so then let's talk about the blood level analysis, because this is where it gets really interesting in terms of looking at what these dosages were actually doing. So they analyzed over 1,400 inpatients, and their mean vitamin D level was 74.4 nanograms per milliliter, and an overall mean of 118 nanograms per milliliter.
So 118, that would typically be considered high by normal standards, right?
Yeah.
So this is the amount of vitamin D that's circulating in their blood.
Yeah. But what's really interesting is that despite that high level of vitamin D, their mean blood calcium level was still within the normal range, according to medical guidelines.
Oh.
So it seems that high vitamin D in their blood wasn't translating to dangerously high calcium levels.
I see.
And then they also had a control group who weren't taking any vitamin D supplements.
Right.
And their vitamin D levels were, unsurprisingly, much lower.
Okay.
But their mean calcium level was also in the normal range.
Oh, interesting.
And it wasn't statistically any different. So there was no difference between the two groups in terms of their calcium levels.
Okay.
But what is also interesting is that the parathyroid hormone levels were lower in the people who were taking the vitamin D supplements.
Okay.
Now, connecting that to the bigger picture, when calcium levels are low, the body releases parathyroid hormone to try to raise them.
I see.
So the fact that it was lower in the vitamin D group suggests that maybe their bodies weren't having to work as hard to maintain that balance.
Okay, that makes sense. So taking all of that together, what were the main conclusions about, how well these higher doses were tolerated and whether they were safe over the long term?
Yeah, so the authors of the study, what they said is that long-term supplementation with doses of 5,000 to 50,000 units a day appeared to be safe.
Okay.
And they also said that, this daily intake up to even 60,000 units, in some cases, over several years, was actually well tolerated. And it was safe for the patients and also the staff who started taking it as well.
Wow, so they were seeing it firsthand.
Yeah.
And that's pretty reassuring, I think, for people who are, maybe thinking about, well, what if I was taking higher doses?
Yeah, and it was also interesting that the video pointed out that it took about 12 months for the vitamin D levels to plateau in those people taking the 5,000 to 10,000 units a day.
Really?
Yeah, so they reached a steady state after about a year,
Okay.
which I guess suggests that maybe they were pretty deficient to start with.
Yeah.
Yeah. So that brings us back to that question we were talking about before, which is, given that the body can produce 25,000 units a day naturally from sun exposure, is that upper limit of 100 nanograms per milliliter that's currently considered the high end, is that actually accurate and appropriate?
It really does make you think. If our bodies are naturally designed to, be able to produce and handle that much vitamin D,
Yeah.
are we being overly cautious with our current recommendations?
Yeah, and the commentator in this video, he definitely thinks so. He argues that health authorities worldwide should be increasing the recommended amounts of vitamin D.
Okay.
Yeah, and he says that the current levels are probably too low based on the evidence from this study and from other research.
So, of course, everyone's individual circumstances are different.
Yeah.
The video does mention that, Dr. Campbell himself is taking 8,000 units per day, along with vitamin K2, but he's very clear that that's not medical advice.
Yeah, he's not a doctor.
Yeah. And, always consult your own doctor and get your vitamin D levels checked.
Yeah, always.
That's a really important takeaway here.
Yeah, definitely. We're just here exploring the research and asking questions, not giving medical advice.
Right, exactly. The video also brings up the point that, we have to look at who's funding research.
Yeah.
And the authors of this study said that they had no conflicts of interest to declare, and the research wasn't funded by anyone.
Okay.
And the commentator also makes the point that, there's not really a lot of financial incentive for big pharmaceutical companies to be promoting vitamin D. It's inexpensive, it can't be patented.
Mm-hmm. That's a really interesting point.
Yeah. So I guess the main message here is that, we need to be looking at the evidence and maybe updating our policies based on what the science is showing.
Yeah.
And that governments and health organizations should be reevaluating their recommendations,
Yeah.
in light of this and other research that's been done. And, you, our listener, you like to go to the source, dig in yourself. So the video actually encourages you to find this research paper and read it yourself. Yeah.
Especially the introduction, they say there's some really interesting historical context in there.
Yeah. It's all to read.
Okay. So as we wrap up today, I think the big takeaway here is that this research we've been talking about really challenges what we thought we knew about how much vitamin D we should be getting.
Yeah.
I mean, that difference between what our bodies might be able to make naturally and what's officially recommended is pretty surprising, honestly.
Yeah.
And the fact that this long-term study found that higher doses were actually safe, that's something to really consider.
Yeah.
So this raises a question for you. What does this mean for your health?
Yeah. It might be worth looking into this a little bit more yourself, doing a bit of research. And, maybe having a conversation with your doctor about your own levels and what you need.
Yeah, and here's a final thought to leave you with. If our bodies can naturally produce such high levels of vitamin D from being out in the sun, what happens if we're consistently staying at levels that are much lower than that?
Mm-hmm.
What are the long-term consequences? Yeah, that's a good question. And maybe even on a bigger scale, what other things that we've always believed about health might need to be re-examined as we learn more?
It's a good reminder to stay curious and to always be willing to update what we think we know based on the evidence. Thanks for joining us for this deep dive.